Okay, so good morning, everybody. For you all, it will be good morning only, though I am doing it at night. Today, I'll be talking about the ulna and radius and most of your forearm part. So, and yes, all the best for your exams, for your FAT exam, for your anatomy YY exam. Okay, you will be getting this video tomorrow morning, and today is a very important topic which I'll be talking about. It will be a huge video, right? Huge content. So I'll be telling you all very slowly. Listen to it carefully, okay? It's a little confusing part, but I hope you will be able to understand. See, bones of the forearm are ulna and radius. Okay, I'll first be talking about the features, then I'll be talking about the joints, and then the muscle attachments. Okay, so the features of ulna, it resembles the fibula bone of your leg. Okay, it's a long bone. It has a primary center, one primary center, and two secondary centers for its ends. Okay, in the upper end, it has the olecranon process. This is the olecranon process. This is the coracoid process, and this notch is the trochlear notch. Okay, trochlear notch. Here you will be seeing another notch, okay, just lateral to the trochlear notch. On the trochlear notch, okay, not much of trochlear notch, but the lateral surface of the coracoid process. Okay, there is another notch called the radial notch, which gives articulation to the head of the radius, forming which joint? Superior radio-ulnar joint. Okay, as I said, I'll talk about the joints later on. Acha. And just below the radial notch, see, just below the radial notch, there's a crest posteriorly placed, and that's called the supinator crest. Okay, now coming to the shaft. Acha. Before coming to the shaft, let me talk about the lower part. The lower end has a small styloid process. Okay, there's a small styloid process, and there's a head of ulna. Okay, there's a head of ulna. So, how to hold this bone in anatomical position, right? Place the radial notch laterally. Okay, it should be placed laterally. Your styloid process should be inferomedially, posteromedially. Okay, posteromedially the styloid process should be placed, and yes, this is your anatomical position. This is your anatomical position. Okay, this is your anatomical position. It's the right ulna. Talking about its borders, you have to hold it in, as I said earlier also, you have to hold it in anatomical position, and you have to talk about the borders. Okay, you have to talk about the borders. This sharp border, which is continuing from the supinator crest. Okay, this sharp border continuing from the supinator crest is the interosseous border. Okay, also called the lateral border. Okay, then you have another border, the anterior border, which runs from the ulnar tuberosity till your front of the styloid process. Okay, that's called the anterior border. That is the anterior border. Okay, yes, another thing is the interosseous border. It ends at the ulnar head. Okay, head of ulna actually. So anterior border starts from the ulnar tuberosity till your front of styloid process. Coming to the posterior border runs from the upper surface, now बोलो posterior surface of the olecranon process. Okay, posterior surface of the olecranon process, the triangular impression archi, the apex of the triangle, from the apex of the triangular impression till the back of the styloid process. This is the posterior border. Talking about the posterior, talking about the surfaces. Okay, talking about the surfaces between the interosseous border and the anterior border is the anterior surface. Between the interosseous border and the posterior border is the posterior surface, and between the anterior and posterior surface, anterior and posterior borders is the medial surface. If you hold it in anatomical position, you will be able to understand the surfaces: anterior surface, medial surface, posterior surface. Okay, so these are the features of ulna. Talking about the radius. Radius is also long bone. It has one primary center for the shaft, two secondary centers for your ends. Okay, the upper end has the head of humerus, the superior surface being concave, head, neck, and the radial tuberosity, which gets placed within the supinator fossa. Okay, within, not the supinator fossa bola jeto hai ki? Actually yes, supinator fossa. It gets housed within the supinator fossa. The supinator fossa is the triangular depression present just below this one, the trochlear, the radial notch. Yes, the radial notch, right? Okay, so coming to the radius, this is the radial tuberosity, head and the neck. Coming to lower end has a styloid process that is longer than the styloid process of the ulnar bone, the ulna. Okay, this is a styloid process. This is a tubercle called the dorsal tubercle of Lister. Okay, it has a significant importance as it gives attachment to a very important structure on the back of your wrist called the extensor retinaculum. Okay, one slip of extensor retinaculum gets attached to the dorsal tubercle of Lister. Talking about the shaft, well, the shaft has a medial border, a sharp medial border, which begins from below the radial tuberosity till your triangular depression here. This is the ulnar notch actually. Okay, there's the ulnar notch on the medial surface which gives attachment to the ulnar head, like this. Okay, like this, to form the inferior radio-ulnar joint. So this is the very sharp border, the medial border or the interosseous border. Then you have the anterior border. The anterior border begins from below the radial tuberosity and continues till the styloid process. See, from here till here. Okay, this is the anterior border. Talking about the posterior border begins from the inferomedial aspect of the radial tuberosity. Okay, it's ill defined in the upper and lower parts, but very much defined in the middle part, this part. Okay, it's sharp, little sharp in the middle part, and this is the posterior border. Okay, continuing till the back. So the surfaces between the interosseous border and the anterior border, you have the anterior surface. Between the posterior border and the anterior border, you have the lateral surface, and between the interosseous border and the posterior border, you have the posterior surface. Okay, right? So these are the features of the radius. Now talking about the joints. Well, one thing, anatomical position. So placing the radial tuberosity medially, little medially and forwards, and your ulnar notch medially. Okay, and the dorsal tubercle blister behind. If you follow these points and keep the bone like this is your anatomical position. Okay, it's the right radius. You will hold like this, and you will tell all the borders, surfaces, holding it in anatomical position. Okay, now talking about the joints. This is your total forearm skeleton. Okay, this is how your bones articulate. This part is the superior radio-ulnar joint, and this part is the inferior radio-ulnar joint. Okay, so the superior and the inferior radio-ulnar joints are plain synovial joints. The ligaments which are involved in superior radio-ulnar joint are the annular ligament, okay, the quadrate ligament, and obviously the capsular ligament, which is common for all joints. While the inferior radio-ulnar joint, you have the articular disc, which is triangular in shape, and you have the capsular ligament. Okay, the superior, the nerve supply. By the way, both the superior and the inferior radio-ulnar joint have movements of supination and pronation, because supination and pronation. Now talking about the blood and nerve supplies. Your blood supply to the superior radio-ulnar joint is from the arterial anastomosis around the elbow joint. I hope you have studied about the arterial anastomosis around the elbow joint by now. Okay, and your inferior radio-ulnar joint, this joint is supplied by the anterior and posterior interosseous arteries. Okay, this is a blood supply. Talking about the nerve supplies, the inferior radio-ulnar joint is supplied by the anterior and posterior interosseous nerves. Okay, while your superior radio-ulnar joint is supplied by the radial nerve through the nerve to anconeus, musculocutaneous nerve through the nerve to brachialis, ulnar nerve, and median nerve. Okay, this is how you have to tell about all the nerves. I am telling these in details. You don't need it in your immediate viva, but for your revision purpose you need it, right? All these you need to tell about the radio-ulnar joints. They are plain synovial joints. Okay, plane synovial joints. Sorry, plane, not plane, sorry. Pivot type of synovial joint. Pivot is the name. Yes, it's actually pivot because the head is actually moving like this. Okay, so it's pivot type of synovial joint, not plane synovial joint. Pivot type of synovial joint. Talking about the elbow joint, well, so this is the humerus. The trochlear notch gets articulated like this to the trochlea of the humerus. This is how your humero okay, this is not actually the bone of oh right, and this is the left side of humerus. I don't have the right sided one. Anyways, just remember that the trochlear notch gets articulated to the trochlea of the humerus to form the humero-ulnar part of the elbow joint, and the radius, the head of the radius gets articulated to the capitulum of the humerus to form the humero-radial part of the elbow joint. Okay, so you have three joints at the cubital fossa. Okay, these are called the cubital articulations. Okay, these are humero-ulnar joint, humero-radial joint, and superior radio-ulnar joint. These are the three cubital articulations. The elbow joint is a synovial joint of hinge variety. Okay, it causes flexion and extension only. Okay, flexion can extend up to 140 degrees. So the articulating surfaces are above our trochlea and capitulum of humerus, while here below there is the head of radius and the trochlear notch of the ulna. Okay, these are the articulating surfaces of the elbow joint. And then you have the ligaments. The ligaments are nothing, very easy. Medial ligament, okay, and lateral ligament, or ulnar ligament and radial ligament. Okay, I think ulnar collateral ligament. Okay, ulnar collateral ligament and radial collateral ligament. Acha. Ulnar collateral ligament has anterior, intermediate, and posterior fibers. Okay. Bursas, talking about the bursas, you have the subtendinous olecranon bursa, subcutaneous olecranon bursa, and bicipito-radial bursa. Okay. Then the blood supply is by the arterial anastomosis around the elbow joint, obviously, and nerves. Nerves are obviously median nerve, ulnar nerve, radial nerve, and musculocutaneous nerve. One thing which I can show in my left humerus is that the medial flange of the trochlea is 6 millimeters deeper, okay, below than the lateral flange of the trochlea. This is a very significant feature to be seen because when you extend your elbow is not actually straight, it is oblique. Right? It is not straight, it's oblique. This is because the forearm gets deviated due to this below thing, this deeper part of the medial flange of trochlea, right? Because it is projecting more below, it is deviating the forearm away from your pelvis. Okay, this is called the carrying angle, the angle between the axis of arm and axis of forearm is called the carrying angle. It is below 10 degrees in males, while it is 10 to 15 degrees in females. No, it is 10 to 15 degrees in males and above 15 degrees in females, because females have wider pelvis, so that because of which, to prevent the rubbing of the arm and forearm to the pelvis, the carrying angle in females is more prominent. In males it's not much, but in females it is very much prominent. Okay, and talking about the carrying angle, the carrying angle is disappears when you place your hand in pronated position. Okay, when you place your hand in pronated position and in flexed elbow, okay, then this carrying angle disappears. So this is the significance of carrying angles in females. Okay, this is the significance of carrying angle in females. Hopefully you all understood the elbow joint, the superior and the inferior radio ulnar joints. Okay, so muscle attachments in your forearm. In your forearm there is first flexor group of muscles. Okay, flexor group of muscles, and you have the extensor group of muscles, right? Flexor group of muscles and extensor group of muscles. Always remember, when you are talking about the action of a muscle, the muscles which are present in front, when you are placed in anatomical position, the muscles in front flex any joint which is present near to it, or any joint through above which it passes. Okay, while the muscles which are present at the back, they extend any joint, okay, which is near to it or passes over it, right? Keep this rule in your mind, then only action is just in your hands now. Okay, you can just write it down in your own words, the action of a muscle. So you have the superficial flexors and the deep flexors. When you dissect your hand, your superficial muscles which are present when you retract the superficial fascia, the muscles which you see on your forearm, on the front of forearm, are from lateral to medial. First pronator teres, then flexor carpi radialis, palmaris longus, flexor carpi ulnaris. Okay, retracting the muscle in between, you will get the this one, yeah, digitorum profundus, flexor digitorum profundus, flexor digitorum superficialis. Okay, flexor digitorum superficialis. Then retracting the flexor digitorum superficialis. Okay, you will enter the deep compartment of the forearm, of the front of forearm, which has your laterally, which has flexor pollicis longus and flexor digitorum profundus, okay, which is present medially. Laterally flexor pollicis longus and medially flexor digitorum profundus. Okay, these are the muscles which you will see on the front of forearm. Very simple. Front of forearm is very simple. अच्छा, so first completing the front of forearm. Front of forearm में কোন কোন মাসল তাহলে বললাম? pronator teres এর আমি কি কি বলেছি, which previously where I have taught about pronator teres. Pronator teres I have taught about in humerus. Humerus কোথায় ছিল? In the medial epicondyle, just above the medial epicondyle, right? খুব ভালো কথা। এবার the pronator teres gets attached. Okay, the pronator teres, after passing from the medial epicondyle, it passes sharply laterally, okay, and gets attached to the lateral surface of the radius. Okay, the lateral surface of the radius, there is a impression on the lateral surface. This is the impression for pronator teres. ঠিক আছে? It helps in pronation. Okay, pronator teres helps in pronation of the elbow. And talking about its nerve supply, it is by the median nerve. Okay, right? pronator teres হয়ে গেল। এবার আমরা আসছি flexor carpi radialis. flexor carpi radialis কোথায় কোথায় আছে? flexor carpi radialis is present on আরেকটা জিনিস হচ্ছে common flexor origin of all the flexor muscles of all the superficial flexors of forearm originate from the medial epicondyle. So flexor carpi radialis এর origin কোথা থেকে? It is from the medial epicondyle of the humerus, gets inserted into the base of second and third metacarpals. Okay, its nerve supply is by this one, median nerve. Action, it abducts the wrist, right? Now coming to palmaris longus. Palmaris longus also originates from having the common flexor origin from medial epicondyle, and it gets attached to the palmar aponeurosis. Okay, palmar aponeurosis blends with the palmar aponeurosis of your palmar hand. এখানে palmar aponeurosis is there. Also, palmaris longus is supplied by the median nerve. Coming to flexor carpi ulnaris, right? Flexor carpi ulnaris, flexor carpi ulnaris, it arises from many parts. Okay, first of all, it comes from the medial epicondyle of humerus. Very good. It also arises from the medial margin of the more precisely telling, medial surface. Okay, of the olecranon process, also the medial surface of the coronoid process, and from the medial collateral ligament, and also from the posterior border of the ulna by the deep fascia of forearm. Okay, by the deep fascia of forearm. কি বললাম তাহলে? medial collateral ligament, medial surface of the olecranon process, from the medial aspect of the coronoid process, and from medial epicondyle, and from the posterior border of your ulna, right? By the deep fascia of forearm, also by an aponeurosis. Okay, aponeurosis তোদের বইতে লেখা আছে বিশাম সিং এ, otherwise you can say deep fascia of forearm. Deep fascia of forearm gives rise to flexor.
Sorry, I'm having trouble connecting to the internet. It looks like there is an issue with the router and echo device. So try restarting them. Unplug both of them, then plug the router back in. Wait 30 seconds. Once the router is back on and connected to the internet, plug in the echo device.
Sorry for the interruption. My Alexa actually started, I don't know what Paul was. মাথা খারাপ আছে, যাই হোক So you're talking about the posterior surface, the posterior border. Okay, the posterior border gives rise to flexor carpi ulnaris. Flexor carpi ulnaris, its function is it adducts the wrist, and its nerve supply is by ulnar nerve. Okay, not by median nerve, ulnar nerve. Okay, coming to flexor digitorum superficialis. Okay, flexor digitorum superficialis. Flexor digitorum superficialis arises, it has two heads. Okay, one is the radial head. Okay, so your radial head, in the radial head you have the anterior border. Okay, the anterior border, it is first of all, in the initial part it is oblique. Okay, the anterior border is oblique and then it is vertical. The oblique part of the anterior border gives attachment to the radial head of flexor digitorum superficialis. Okay, in the ulna, the flexor digitorum superficialis arises from the medial aspect of the coronoid process. The medial aspect of the coronoid process. Okay, flexor digitorum superficialis. So the flexor digitorum superficialis gets attached to the medial the medial 4 digits. Okay, the medial 4 digits. It gets divided after entering into the hand. It gets divided into superficial and deep parts. The superficial parts get attached to the ring and middle fingers, while the deep parts get attached to your rest of the other two fingers, the index finger and the pinky, the little finger. Okay, and they get attached to the middle phalanx. Okay, by dividing into two slips, and they attach to the middle phalanx. Each part, okay, which enters the finger gets divided into two slips and gets attached to the middle phalanx. Its functions are, it flexes the proximal interphalangeal joints, also sometimes the metacarpophalangeal joints, the MP joints. Okay, talking about the deep compartment of forearm, deep compartment, one another muscle I missed out is prolata quadratus. Keep that in mind. It is deeper to FPL and FDS. Okay, FDP, FPL and FDP. Okay, so FPL, flexor pollicis longus. Flexor pollicis longus. Flexor pollicis longus, it arises from the upper part of the anterior surface. Okay, from the upper part of the anterior surface arises the flexor pollicis longus and its aponeurosis, and the adjacent interosseous membrane. Yes, sir? Flexor pollicis longus
Sorry,
also.
I'm having trouble connecting to the internet. It looks like there is an issue with the router and echo device. So try restarting them. Unplug both of them.
चुप थक एलेक्सा के बोलना. So your flexor, क्या बोलছিলাম, flexor pollicis longus. Okay, flexor pollicis longus arises from the anterior surface, upper part of the anterior surface of radius, and then also sometimes occasionally from the medial aspect of the coronoid process. Okay, an occasional head of flexor pollicis longus. Okay, there is a remnant of the third head of flexor pollicis longus, which is called the oblique cord. Okay, keep that in mind. It's the oblique cord. Okay, the oblique cord gets attached from the lower part of the ulnar tuberosity till the lower part of the radial tuberosity. Right? It's called the oblique cord. Okay, so FPL is, then it gets attached to your thumb. Okay, it is for your thumb. the middle phalanx of the thumb, right? And its nerve supply is by anterior interosseous nerve, which is also which is a part of the median nerve. Okay, anterior interosseous nerve, and its functions are the movement, the flexion of PIP and your MP joints of the thumb, right? Now flexor digitorum profundus, huge origin actually. Okay, humero-ulnar origin, it is said to be from the medial epicondyle of the humerus, right? Also from the medial margin of the olecranon and the coronoid process. Also that was the humero-ulnar origin. Okay, the head of the humerus involved in the head of the ulna and the medial epicondyle of the humerus. Also another origin is there, which is from the posterior border of the ulna, similar to flexor carpi ulnaris, okay, by an aponeurosis or the deep fascia of forearm. Okay, this is the case. And it gets inserted to your medial four fingers. Okay, medial four fingers, in the same manner as what flexor digitorum superficialis was getting attached, and flexor pollicis longus. Just that superficialis is present superficially and profundus is present deeply. Talking about a very small muscle, another thing is the flexor digitorum profundus is nerve supply. Okay, nerve supply medially, it is supplied by the ulnar nerve, laterally by the anterior interosseous nerve, named as the median nerve. Okay, pronator quadratus, very small muscle present on your lower part of the anterior surface of the ulna, right, and your lower part of the surface of radius. ठीक है, lower part of the radius. Okay, anterior surface of the radius. 1/4 surface, anterior surface of the ulna, 1/4 surface of the anterior surface, 1/4 part of the anterior surface of the radius, right? This is your origin, insertion, vice versa. You can see pronator quadratus, not much important. Nerve supply is by anterior interosseous nerve. Yes, it helps in pronation of your forearm. Yes, this is all about your flexor compartment of forearm, the front of forearm. Congratulations. Okay, and coming to another very important structure, it is present here actually. It's the back of forearm and also your extensor retinaculum. Okay, extensor retinaculum. Acha. Before coming to extensor retinaculum, okay, some parts, some things to be taught about the upper end of ulna. This is the olecranon process. It has the upper superior surface, the anterior surface, okay, the the lateral surface. No, sorry, the medial surface. This is the medial surface, and this is the lateral surface, which is continuous with the radial notch. The anterior surface forms the upper part of the trochlea, the trochlear notch, and there is a coronoid process. Also has the upper surface, anterior surface, okay, the lateral surface, and the medial surface. Okay, the medial surface. The anterior surface, the upper part of the coronoid process, this is the lower part of the trochlear notch, forms the lower part of the trochlear notch. Superior surface of the olecranon process, the superior surface provides attachment to the capsular ligament, okay, of the elbow joint and the triceps brachii from before backwards, right? Now the medial margin. The medial margin gives the medial margin gives attachment from before backwards capsular ligament, okay, the oblique band of ulnar collateral ligament. Then you have flexor carpi ulnaris, okay, flexor carpi ulnaris, and the most highest origin of flexor digitorum profundus, okay, the medial margin of the olecranon process. Lateral margin gives attachment from before backwards to similar capsular ligament, radial collateral ligament, and the anconeus, okay, and the anconeus. The posterior surface of the olecranon process is related to a bursa, right? Coming to the coronoid process, the coronoid process and the superior surface, as I said, forms the lower part of the trochlear notch, right? Lateral surface of the coronoid process, okay, is continuous with the radial notch, right? This entire coronoid process, the anterior margin of the coronoid process gives attachment to the brachialis muscle. And you have the medial surface of the coronoid process, below which is present the ulnar tuberosity, right? Now this radial notch, the anterior and posterior borders of the radial notch give attachment to the anterior and posterior fibers of annular ligament, right? And there is just below it, there is a fossa, there is a triangular depression which is called the supinata fossa. The supinata fossa, and this is the crest behind, which is the supinator crest. Okay, this entire part gives attachment to the supinator muscle, right? Then coming to your medial margin. The medial margin of the coronoid process gives attachment from above downwards. From above downwards, you have the occasional head of flexor pollicis longus, right? Ulnar head of pronator teres, okay, there is an ulnar head of pronator teres also, and you have the flexor digitorum superficialis, okay, the ulnar head of flexor digitorum superficialis. Okay, this is all about the upper surface of the ulna. There is the interosseous membrane attached to the interosseous border all along, above which there is a gap, and above the gap is the oblique cord, right? Through the gap you have passes the posterior interosseous vessels but not the nerves, okay? Now related to your anterior surface of the radius, okay, on the interosseous membrane you have a synovial sac, okay, called the recessus saxiformis, synovial prolongation of the inferior radioulnar joint. Keep that in mind, right? Talking about the radius, radius upper part, this entire circumference of the radial head gives attachment to the annular ligament. The neck also gives attachment to the annular ligament and also to the quadrate ligament. As I said, the superior radioulnar joint has three ligaments: the capsular ligament, the quadrate ligament, and the annular ligament. The annular ligament is attached to the anterior and posterior borders of the radial notch and to the entire circumference of the radial notch. Then you have the radial tuberosity. Okay, behind the radial tuberosity there is a depression which gives attachment to the biceps brachii. Okay, and a bursa might intervene between the bone and the biceps brachii. ঠিক আছে? Here behind. Okay, this is biceps brachii. ঠিক আছে? Rest of the things are in your back only. So I'll talk about the back in my back of forearm in my next video. As of now, study these ones. I have told about your nerve supply, action also, right? Supinator action is supination. Okay, biceps flexion of elbow, also supination of the elbow when the elbow is flexed. Okay, also supination of the forearm when the elbow is flexed. And triceps, its function is extension of the elbow, right? Biceps is supplied by musculocutaneous, while triceps is supplied by your radial nerve, and supinator is supplied by your posterior interosseous nerve. Okay. Fine. Okay, so see you all in the next video.